You're listening to Vaccine Nation on ReachMD. Your host is Dr. Jennifer Hsu, Chief Resident in Pediatrics at the University of California, San Francisco.
There are certain infection risks to consider when traveling internationally with infants, and many of these may be prevented with proper immunization. First, children should be up to date on their routine vaccines that are given in the first year. In addition, infants 6 through 11 months of age should receive 1 dose of MMR vaccine. MMR vaccine is usually given later than some other childhood vaccines because antibodies transferred from the mother to the baby can provide some protection from disease and can also make the MMR vaccine less effective until about 1 year of age. Therefore, this early dose of MMR vaccine given at 6 to 11 months of age in children traveling internationally does not count towards the recommended vaccine schedule. Infants who get 1 dose of MMR vaccine before their first birthday should still get 2 more doses, 1 dose at 12 through 15 months of age and another dose at least 28 days later. Because typhoid vaccine is not recommended for children under age 2, it's important to follow precautions to avoid typhoid fever. Typhoid fever is common in most parts of the world, except industrialized regions such as the United States, Canada, Western Europe, Australia, and Japan, so travelers to the developing world should consider taking precautions. Travelers to Asia, Africa, and Latin America are especially at risk, and the highest risk for typhoid is in South Asia. Be sure that children eat safe foods, such as food that is cooked and served hot, hard-cooked eggs, fruits and vegetables that you've washed in clean water or peeled yourself, and pasteurized dairy products. And although there's not a vaccine for malaria, it's important for even young children to try to avoid malaria transmission. Even young children should be protected against malaria transmission, although there is not a vaccine against malaria at this time. It's important to avoid mosquito bites using netting or insect repellents, and your physician may prescribe anti-malarial drugs to children traveling internationally. Hepatitis A vaccine should also be given to infants aged 6 to 11 months who are traveling outside the United States. The travel-related dose for infants aged 6 to 11 months does not count toward the routine 2-dose series. Therefore, the 2-dose hepatitis A vaccination series should be started at age 12 months according to the routine age-appropriate vaccination schedule, with a second dose given 6 to 12 months later. Typhoid fever is common in most parts of the world except industrialized regions such as the United States, Canada, Western Europe, Australia, and Japan. Typhoid fever is common in most parts of the world except for industrialized regions such as the United States, Canada, Western Europe, Australia, and Japan. Because typhoid vaccine is not recommended for children under 2, it's important to follow precautions to avoid typhoid fever. This includes eating safe foods, such as food that is cooked and served hot, hard-cooked eggs, fruits and vegetables that you have washed in clean water or peeled yourself, and pasteurized dairy products. Do not eat food that is served at room temperature, food from street vendors, raw or soft-cooked eggs, raw, undercooked, or rare meat or fish, unwashed or unpeeled raw fruits and vegetables, condiments such as salsa made with fresh ingredients, salads, or unpasteurized dairy products.
You've been listening to Vaccine Nation on ReachMD. For more highlights for this and other important information, visit reachmd.com/vaccines, where you can join the conversation and be part of the knowledge.